Over the last decade here in Colorado, nearly 5,000 Coloradans died from prescription opioid overdose. As Colorado Attorney General, I'm committed to addressing this opioid crisis. That's why we brought litigation against irresponsible actors in the pharmaceutical industry who hurt people by pushing out dangerous drugs.
I was prescribed 360 pills in a month period after I had gallbladder surgery. I was hooked. The doctors had cut me off, and I had gone to the streets to start buying pills. I lost my apartment, I lost my home, I lost my job, so I was literally sleeping on the train tracks at the Fort Collins Rescue Mission. I had to get some clean time in me so that I can get into treatment. I went to go check myself into that treatment center, and I had like 27 days clean off of heroin at the time, and they turned me away.
Having done this for the last 10 years, it is so apparent to me that our system, while it is well intended, and there are some parts of it that are really well built, it isn't complete. We need greater access to treatment. There is no harder place to be than in a setting where the level of care that your patient needs is simply not available. We've had people die on our waiting lists.
There's a lot of shame and guilt, right? So a lot of people don't want to come out and talk about their story. My experience has been is you either have to have a lot of money to get into treatment or go cop up a bunch of felonies, and the justice system will put you in a treatment bed, and that's not okay.
Now, these companies are being held to account, with $400 million coming to Colorado. The real work to address this crisis starts now. It's going to give us an opportunity to do something critical, addressing opioid use disorder by providing more drug treatment, more drug recovery programs, and better education and prevention efforts.
My twin nephews both became heroin addicts after being prescribed Oxy after having shoulder surgery. So nobody is free from this. It affects our entire communities, our entire families, and it does take a village.
What I can tell you now, after 40 years of law enforcement, is that if arrest, stigmatization, and incarceration worked with drug users, we wouldn't be here today. I'm excited at the prospect of actually seeing this cohesive effort come together and maybe make a real dent in this, because the problem is getting worse and worse and worse, and we've got to find a way to get it under control. When we do this together, we can save lives.
We've got a lot of work to do to address this crisis. Our office is committed to that important work.
This settlement and the agreement are going to give us powerful tools to start regaining ground, because the human cost of this fight is real and it has been heartbreaking.
Pueblo County signed this agreement because we have waited long enough to fight back and fight for those that have been victimized.
We've worked together across rural, urban, and suburban communities to best leverage settlement funds for treatment, for education, recovery, and of course prevention.
But most of all, this chapter is about hope. And it's a hope that our friends and family members who at one time sought help from these companies and professionals will be able to get it.
I'm excited that the counties can come together and the municipalities can come together so we can actually start working on some of the problems that we've identified.
I have a voice today. I get to help others on their recovery journey and tell them my story. People recover. People can be contributing members to society. Moms can be moms again. Dads can be dads again. People can be an effective part of the community again.
Doing this together is changing lives. To find out more, please go to coag.gov/opioids.